Hello, I'm Evelyn Miles, and I'm here to teach and demonstrate about proper phlebotomy skills and competent drawing methods. Count Dracula has been known for the following quote, "I want to suck your blood." I can usually tell when patients are at ease and of good humor, and I'm often called a vampirist, so if the atmosphere permits me to do so, I joke with my patients and tell them, "I want to get your blood." They usually laugh, and it puts them at ease. It is very important for a patient to be at ease. Getting a needle stick hurts, and oftentimes the patient can get very nervous, which can cause changes in blood pressure, hyperventilation, and even fainting. I am a Darton College nursing major, and I have been a phlebotomist for 2 months. East Georgia Regional Hospital hired me based on their belief in my ability to train on the job to perform the function of phlebotomist. I have been on my own drawing patients for 6 weeks and draw an average of 30 patients per day. It is a very high-paced and stressful environment. Phlebotomy is defined as the act or practice of opening a vein by incision or puncture to remove blood as a therapeutic treatment, also called venesection. The prefix phleb or O means vein, and tomy refers to incision. It is essential to the patient that the phlebotomist is well trained at obtaining blood samples with accuracy, compassion, and confidence. In order to draw a blood specimen, certain supplies and tools are needed. Usually I carry a phlebotomy cart with a basket that has all of my supplies in them. A sampling of these supplies are shown right here. We have a transfer device. This is a butterfly needle, usually used on neonates or someone that has really small veins, such as an elderly person. We have a tourniquet that is used to help constrict the blood vessel to get a proper blood sample. These are all of our tubes in which the blood samples are drawn from. We have a heel warmer. We have a lancet, which is used for heel sticks or finger sticks, and most of the time those are done on infants or people who you actually can't obtain a normal draw from. These are transfer devices. As you can see right here, this transfer device would actually be screwed onto the butterfly in order to insert the tube, and the blood is sucked inside. Syringes are sometimes used to put onto the end of someone's port or central line where blood is withdrawn. And right here we have a 22 gauge needle, which already has a hub attached to it. We also have a 21 gauge needle. It's called a green top that we use. It's a little bit bigger, and it's really good when you have a lot of blood to withdraw. You have to have your sterile gloves, your gauze 2x2s, you have to have tape, and you have to have an alcohol pad, which I have right here, and then a biohazard bag to put all of your blood samples in. Now I'll use a participant from the audience to demonstrate the proper way to draw a blood sample using phlebotomy. And I actually have 2 willing participants right here. I have my husband Sean. He's going to be participant number 1. And I have my daughter Hope, who is participant number 2. I'll actually be drawing Sean using a regular 22 gauge syringe. And Hope, I'm going to demonstrate the use of a butterfly needle. So I'm going to reposition the camera so that we can get a proper view of this demonstration. The most common area for a blood draw is the median cubital vein, which falls in this area. It's on the anterior side of the forearm at the bend of the elbow. The veins in this area are close to the surface and have a low nerve supply. Finger and heel sticks are also a way of obtaining blood, and you would do these on any of these fingers here or on the heel of a patient. Okay, so I'm going to apply my gloves, and normally in a hospital or lab setting we have a sticker that would have the patient's name and the actual blood test that needs to be obtained, and that's how I would tell which tubes I need to use. So we're just going to pretend that I'm verifying who this man is. Can you tell me your name, sir?
Sean Miles.
Sean Miles. And your date of birth?
6/19/71.
And how old are you?
39.
39. Mr. Miles, today we're going to be drawing for a CBC and a CMB, And I'm going to need 2 tubes. My green tube is a chemistry tube, and my lavender tube is for any kind of CBC or hemoglobin test. So we'll be drawing with those. I'm going to swab your arm or your area off and get an idea if I like the vein in this arm, which I don't. So we are going to switch sides.